Urinary tract infection is incredibly common in women of all ages. About 40 to 60% of women suffer from urinary tract infection at some point in their life. Hi friends, this is Dr. Rajeshwari Reddy. I am a senior gynecologist working at Hyderabad. So today we will be talking about urinary tract infections, the causes, the symptoms and the treatment, and also how to prevent urinary tract infections. So what is the urinary tract? Urinary tract consists of two kidneys which are located in the abdomen and a pair of ureters connecting the kidneys to the urinary bladder. So the kidneys secrete urine, the ureters carry the urine from the kidneys into the bladder. The bladder is a hollow organ, a bag-like structure where the urine gets collected. So when the bladder is full, we get a sensation to pass urine from the bladder through the urethra to the outside. Urinary tract infection is 4 times more common in women than in men. There are 2 reasons why it is so. The first one being the urethra in women is much shorter as compared to the urethra in men. And secondly, the position of the urethra. It is just above the anus and the vagina, whereby there is more chance of bacteria getting transferred into the urethra and causing infections. So bacterial infection is the most common reason for urinary tract infections, and rarely we also see candidial infection. So what are the symptoms of urinary tract infection? The most common symptoms of urinary tract infections are burning pain while passing urine, increased frequency of micturition whereby the patients feel like going to urine again and again, but when they go and sit on the commode, very few drops of urine comes out. And then urge to pass urine, like when they want to pass urine, they cannot control, they have to immediately rush to the washroom to use it. And also sometimes people have blood stained urine, foul smelling urine, pain in the lower abdomen, low backache, flank pain, and when the infections are very severe, we see patients with high grade of fever with chills and drivers associated with nausea and vomiting. So what are the common causes of urinary tract infection? Inadequate hydration, as in we need to have at least 3 to 4 liters of water intake every day, and holding back urine, not passing urine when the bladder is full, and using unhygienic washrooms, wearing very tight clothes, usage of say vaginal deodorants or harsh soaps or perfumes, or using synthetic undergarments for a long time. And also we see it in certain immunocompromised states, as in pregnant women, patients suffering from diabetes mellitus, postmenopausal women, people suffering from debilitating diseases, as in bedridden patients, and also prolonged catheterization, as in any post-surgical period. Urinary tract up to the bladder is most common, which is called cystitis. And then sometimes we see ascending infection, where the infection, when neglected or untreated or treated partially, going in for ascending infection, where the infection spreads from the bladder into the kidney, and this is called pyelonephritis. So how do you diagnose urinary tract infection? Sometimes patients just walk into the OPDs with urine examination reports which have pus cells, but they do not have any symptoms. This is called asymptomatic bacteriuria. So in these cases, we just ask patients to have plenty of water, start with 3 to 4 liters of water, and drink water more often, pass urine more often, and this should suffice. But sometimes when patients come with symptoms, as I mentioned earlier, as in burning pain or increased frequency, then we do a urine examination and look for pus cells. And from there on, if there are pus cells, we ask the patient to get urine culture sensitivity test done. Now, urine culture sensitivity test tells us what is the cause of infection, the bacteria which cause the infection, and also the appropriate medicine that is required to treat this infection. We'll be able to effectively treat the urinary tract infection so that it doesn't recur again and again. Sometimes we also ask for ultrasound abdomen and pelvis. This is to rule out any severe form of cystitis or any infection in the kidneys. Now coming to how do we prevent a urinary tract infection? By keeping ourselves well hydrated and by using cotton clothes, using mild soaps, and not over cleaning the vagina, because when you over clean the vagina, say as in with tissue paper or with forceful water, so the natural protection of the vagina gets washed away, thereby it gets more prone to infections. And as I said earlier, not to wear tight clothes, use cotton clothes, loose clothes, not to hold back urine, and of course use barrier method as in condom while having sex. And of course, while washing the genital tract, we have to always wash from front to back, as in first wash the urethra. And I highly recommend that don't buy over-the-counter drugs or refer to Google for treatment of urinary tract infection. This is because if it is not treated well and appropriately, it tends to recur, which is not a good thing. Urinary tract infection, we highly recommend that they have cranberry fruit or cranberry extract tablets or cranberry juice, keep themselves well hydrated. And if they have immunocompromised status, they need to be very particular about their immunity. Immunity is built by having a good lifestyle, regular eating habits, and exercising, and of course consumption of vitamin C also helps in keeping infections at bay. Thank you.